And we go to Austria first. We've had some news flow surrounding Austria, of course. Austria announcing compulsory vaccinations from February the 1st and a nationwide lockdown starting on Monday. Let's get to our reporter, Maria Tadeo, who's on the ground for us. Maria, we were expecting to hear some tougher measures from Austria, but this tougher than perhaps people were anticipating and tougher than other European countries so far.
It is, Anna. This is much more drastic than anything we anticipated just yesterday. The idea was that, of course, a number of regions in Austria could go into a lockdown, but this is the entire country for 22 days starting Monday. The government also says that it will enforce a vaccine mandate for the entire country. Now, these are the most drastic measures so far in Europe to deal with this new wave of coronavirus. A lot of this, of course, responding to inefficient measures to reach out to unvaccinated people to get the vaccine. The problem that a lot of governments are dealing with, and particularly in Austria right now, is that they have not managed to convince people to get the vaccine. They're dealing with a very challenging situation with people who for 6 months have decided they don't believe in the vaccine or they don't believe in government and therefore they don't want to take it. And until now, the incentives have not worked. So they're going for much more dramatic and drastic measures. And also over in Germany, Anna, you alluded to this too. We hear from the health minister also saying we're not going to exclude a lockdown, and it is clear the vaccines at this point are not going to do the job. We need more.
Yes, indeed. The Austrian example saying, yes, as you say, the Chancellor there saying that they've not been able to convince enough people to vaccinate. And Jens Spahn, the German health minister, I think we have some live images of that press conference still taking place, saying they can't rule out a lockdown in Germany. The Austrian example then, we have the lockdown there, 20 days. What do we know about the measures that Germany is considering or the state of the coronavirus fight in Germany?
Well, you know, Anna, when you look at the numbers in Germany, they do point to an infection rate that is going through the roof, but they also show that hospital rates and hospital admissions are also jumping ahead of winter. Angela Merkel was very clear yesterday saying this is a new wave that is hitting the country in full force. Now, we have seen a number of measures now kick in for unvaccinated people. You're not allowed in restaurants, you're not allowed in venues in an area that's badly hit if you're not vaccinated. But what is changing the narrative this morning, of course, is that the government is escalating today the language, saying we're not going to exclude lockdowns anymore. And of course, we see that the booster shot and the vaccine, that may not be enough. We need a break to end the cycle that the country is in right now. So that's suggesting perhaps that we're going to see much tougher restrictions kicking in. The question is whether this is a whole of Germany or just regions that are badly hit like Bavaria.
And I should just mention, I said that we had a press conference taking place with Jens Spahn speaking, the German health minister, of course. He is in attendance and is intermittently speaking at that press conference. Also have images of Robert Koch Institute President Lothar Wieler, who is currently, I think, with the microphone, but he is with Jens Spahn. There you see him, the German health minister. He's commenting at this news conference, and these lines coming through then. Germany not able to rule out further lockdown measures on the same day as we hear pretty drastic measures coming in Austria. Maria, worth just reflecting on the divergent performance we're seeing across different parts of the EU, isn't it? Because we're focused, of course, on the epicenter of this wave, and focused on where this fight is toughest, where vaccination rates are lowest, and that is in Central and Eastern Europe, to simplify things possibly a little too much. But in Southern Europe and in other parts of Western Europe, in France, in Spain, it's a bit of a different story.
Yes, and Anna, and also just briefly, I mean, you mentioned the head of the Public Health Institute in Germany speaking at that press conference right now. They have been very critical of the German government, saying they're not taking, or they did not take preventive measures, partly, potentially, because of the election. Nobody wanted to rock the public opinion, and this is now the repercussion of not doing enough to prevent the spread of this. The National Health Institute in Germany was very clear just a few weeks ago that the wave was already taken on, and they called for measures weeks ago, which of course are only happening now. In terms of the divergence that you referred to, Anna, you know, to say this is a full wave across Europe would not be accurate. We know that in countries like Portugal, Spain, even Italy, France, countries that have enforced a health pass, but also a vaccination mandate for public workers and hospital workers, the infection rate is much more controlled, or much more under control. So it does show that this is not a full story happening in Europe. It really is now about Central Europe and Eastern Europe and the big no-vax movements that we've seen in some of those countries.